Miss Everly had her RCH appointment already this week. More changes are coming following the huge seizure she had on the weekend. We had our PEG clinic appointment, meeting with the social worker to meet our new social worker, because Everly's with complex care. It comes with a social worker as well and a complex care nurse, so we got to meet him for the first time. And we had our neurology appointment. So PEG went great. There's nothing structurally wrong with the PEG. It's healing well. They want us to put a steroid cream just on the insertion point just to try and help it heal a little bit quicker, but that's not why Everly's screaming. So I think she's just relating the PEG to her tummy pain because it's a physical thing that she can pull at. And like, she'll want us to vent her. For those of you that don't know, venting is when I connect a syringe so that the trapped air can get out of the syringe. Nothing comes out. So it's like a placebo effect that she'll want that on and it'll help, but she's still uncomfortable. So we need to work out what else is going on with Evan, why she's screaming. Is it intolerances? Is it some GI issues? I don't know. So I'll have an appointment with the complex care dietitian either today or tomorrow. She was going to call me to check in, and we'll go from there. We'll start blended feeds again is the plan, but that will probably cause some tummy pain. Everly did so well. We went for a walk around the grounds and she got to have a turn on the swing. It was very sweet. Her first appointment was at 11 and her last appointment was at 2:30. So we spent all day there. But we had lunch and she ate broccoli on purpose. I need to call that restaurant and ask what sauce they put on the broccoli, because she ate 3 pieces on purpose. I'm not sure what's happening there, but I'll take it. But we went to the family hub, so a little area that's nice and quiet that Everly could play. And there was a gigantic Connect 4, which made her whole life. I have to get her one of those for her birthday. I have to. And then we see Nero. We're changing our meds again. So we weighed Everly ahead of her appointment. And Everly has gained 1.5 kilos, which also would not be helping our cause right now with trying to adjust meds and her seizures. But it also gives us a little bit of room to move on some meds, which is great. So I'm upping the same med, Steripental, again in the morning. I did that yesterday, so the effects of that will start tomorrow, and that's another week or 2 before Everly will start to be feeling okay. I hate the fact I feel like I have to lose her before I can find her again. I know how crappy she's going to feel. We can't have her having seizures and turning blue with the potential outcomes that come with that too. So I upped the med, and then we made a plan for if she's a little bit sedated still in 10 days, or I feel like it's gone the other way and it's too much. So then I'll have to wean the clobazam. Now, Neuro, she is amazing. Our neurologist actually did a study and spent a year studying the impacts of a DEE, so severe epilepsies like Dravet syndrome, and what it has on the carers. She has a world of knowledge about all the hats we have to wear and how hard it is and the toll it takes, and she is just so compassionate and gentle in her approach and kind. She's also really inclusive. Everly's care plan, what do you think, Brooke? Do you think we need to increase her med, or do you think she's okay? And obviously at the end of the day she's the neurologist. But I said to her, no, I think we do need to increase. I really don't want to, but we're teetering on a line of we could lose control. They're going for longer, they're more aggressive. Do I want to increase one? No. Do I want her on any of the meds? No. But I think we do need to go up, especially because she's gained weight as well. Like, we're teetering here. It's not as bad as what it was, but it's not perfect. Okay, we'll increase the Steripental in the morning. And then, how do you feel about weaning the clobazam, the benzo? And she's like, look, there could be 2 ways that people could view this. There could be lots of, and she was so gentle. And I said to her, look, I need you to make that decision. I have a lot of trauma surrounding benzo medications and what happened with that medication. Your professional opinion, you tell me what to do with that, because I'm misguided by my trauma. There was a fellow in there learning, so a baby neuro that's learning how to be a consultant, which is our neuro, turned to her and said there was a medication mix-up a 1.5 years ago that was particularly catastrophic. It was really unpleasant, and Everly went through a lot, but so did Brooke. She sees. I just have so much respect for doctors who have bedside manner and compassion like that too, but so much knowledge. So she's decided and said that if by day 10 Everly is over sedated or not doing well, I have to drop the benzo. And I said, and when we lose control, then what? She said, then we'll increase the Fintepla, because thankfully she's put on weight so we can go up on that again. Okay. And it's not if, it's when we lose control. For context on a benzo medication, for those of you that might not know, I will be weaning 2.5 milligrams. Minuscule. Steripental, Everly's on 350 milligrams of that morning and night, 700 milligrams a day. But taking away 2.5 milligrams or adding 2.5 milligrams of this benzo medication can be absolutely catastrophic. That is how potent buying this med is. But it is an excellent resource for seizures. And unfortunately, a lot of the medications that are an excellent resource for seizures come with some horrific side effects. Everly also has low iron again. And I ended up saying, like, is it hereditary? Because, like, I've had low iron my whole life and some issues. Like, can it be a genetic thing? She's like, I'm not sure. Everly already has tummy issues, so she can't have the oral iron because it gives her more tummy issues. So she needs another iron transfusion. Again. Which we had this in May, and I was like, she had low iron, and I was like, well, we'll get the iron transfusion while she's had the surgery for the peg. We'll do it while we're here. And then they did her iron and it came back higher again. Anyway, we need to find time to go and do that as well. She asked me if I wanted to increase the steripental or Fintepla, like which did I think was less on Everly, and I said, well, the Fintepla is less on Everly, but I'm also worried about her heart. Everly's sitting heart rate sits between like 130 and 150 beats per minute. She's almost 5. That's very high. So we need to see cardiology before we increase that med ideally, which we see cardiology next month, and they will do like an echocardiogram, ultrasound on her heart. They will do an ECG. Is it ECG? Yes, it is. Which checks like her heart waves. They might want to do a Holter monitor again, considering how high it is. I'm not sure, but we will speak to cardiology next month. But if we lose control, I'll have to increase the med anyway. But also it's a scary thought that if you increase it too much, her heart might not cope. Because with Fintepla, it's a great medicine, it's amazing, but also comes with 6 monthly echocardiograms. So she has to have an ultrasound on her heart every 6 months to make sure the heart valves aren't thickening, because it can have side effects there. Do you see what we do? This is one appointment. One. That then funnels into a dozen other appointments. This is not even the tip of the iceberg of what I have going on right now. About NDIS and reports and equipment trials. Not even touching the iceberg. But yesterday it started. Tomorrow we will see the effects. Everly will start to have muscle weakness. She will probably opt to sit around and not really walk. She might not really talk much. Her seizures, her myoclonic seizures will probably increase for a little while. She won't want to eat. She can't tell me, but nausea, dizziness, blurred vision. Just some of the side effects. I have to lose her to be able to find her. I have to lose her to find her so we can keep her. So we're in for another hard few weeks, as if the last few haven't really been hard enough. But it was nice to have little Evie back for a week. She was feeling really good for a week and she was doing really well. And hopefully by doing this, she'll be able to get back there and have longer, you know? It's all about weighing up the pros and cons, isn't it? Anyway, that's the Evie update from a neurological point of view.